Hello guys, welcome to Homeo Health Care. So today we are going to discuss on the topic chronic pancreatitis. So before going into that, let us have a small basic overview on the anatomy and the physiology of our pancreas. So our pancreas is a gland which is partially endocrine gland and partially exocrine gland, and it lies in our abdomen. It has parts like head, neck, body, and the tail of pancreas. And this head of pancreas lies in the C-shaped loop of the duodenum, like this. This in such kind, the head lies, which is in the right side, and the tail of pancreas goes up to the hilum of the spleen, which is in the left side, and it is a J-shaped gland. So, what will be the physiological function of this gland? As it is a partly exocrine and endocrine, so it will have both functions. In exocrine, there will be the secretion of the enzymes which is helpful in the digestion of the food. These enzymes like lipase, amylase, it gets secreted via pancreatic duct. And what about then the endocrinal function? In that, the beta cells of the Langerhans, especially the islets of Langerhans, it has the endocrinal function. It has the various types of cells like alpha cells, beta cells, in which the beta cells secretes the insulin, which helps to maintain the sugar level, glucose level of the body, human body. If any alterations comes in the function of insulin, it may lead to hyperglycemia or hypoglycemia. So now, what is this pancreatitis? It is an inflammatory condition of the pancreas, which is of two types, acute and chronic. So, what are the things in the chronic? There will be the fibrosis and destruction of the exocrine tissue of this pancreas due to this inflammatory condition. So, what are the triggering factors due to which the pancreatitis condition gets come up? These are excess consumption of the alcohol. Means in chronic alcoholics, this condition can be seen. And like if gallstones are there, which is or a inflammation of the gallbladder, means cholecystitis. This condition may also trigger the condition of chronic pancreatitis. So, what clinical features you are going to see in the patients of chronic pancreatitis? First and most, there will be the pain in the abdomen. Patient will experience the pain in the abdomen, but the location of pain varies from patient to patient. Some patient may feel the pain in the epigastric region, which is radiating to the right side, and some may experience pain radiating from epigastrium to the left side or back. The type of pain in pancreatitis will be the radiating type of pain. A very few patient can be encountered where a localized pain can be there. In most of the cases, the radiating type of pain will only there. Now, why in some patients there is radiating to the left or radiating to the right? Because if the head is involved in this fibrosis or destruction of exocrine tissues, then pain gets radiated from epigastrium to the right side because head lies in the right side. Or if body or tail is involved in that patient's, they will experience the pain from epigastrium radiating to the back of the left side or a flank. A few patients may experience this radiating type of pain from epigastric region to the left side of shoulder. In few cases, it can be. Now, what is the onset of this pain? Onset is gradual. There will be the low intensity of pain. Then, when this pain gets worsened or when the patient gets relief from this pain, mostly after eating, after having a meal, the patient's pain gets worsened. That means aggravation after meal means postprandial. Then, if these patients lie down, then also their pain may get aggravated. And if patient sits, the quite ameliorated or quite relief from the pain he will get. And if he bends forward, stoop forward, leaning forward, by this the patient may get relief. That means amelioration from the pain. There will be weight loss, anorexia, that means loss of appetite, nausea, vomiting will be there. And what can you see? The passing of these stools. The chronic pancreatitis patient passes the stools which are more greasy, bulky, oily in nature. And the odor also comes from that stools, that is foul odor. So, such clinical features can be seen or you can encounter in the patient of chronic pancreatitis. Then, what investigations you are going to advise, like USG abdomen, CT scan, these things can be advised for the patient. And if the pancreatic duct is dilated, it can be seen in this investigation. And if the barium meal has been done, then there will be the enlargement of the C-shaped loop of the duodenum. If the head of the pancreas are involved in the chronic pancreatitis condition, then what complications can get occur in the patients of chronic pancreatitis if it is not treated on time or there is very much delay in its treatment? Then pancreatic ascites can be there. The ascites means the accumulation of the fluid in the peritoneum. Peritoneal fluid will be more excess. So there will be the swelling over the abdomen. Then what another conditions like pseudocyst can be there, obstructive jaundice. These conditions can be there or duodenal ulcer, peptic ulcer. Such complications may get created in the patients of chronic pancreatitis. So what about its treatment part now? In homeopathy, after taking a case, going through that case and working out on that, what remedy comes of and that will suits to the patient. And after administering that medicine and after a particular course of treatment, a patient will not experience a such condition in which he had come to us. जब कोई क्रोनिक पैंक्रियाटाइटिस पेशेंट की केस ली जाती है तब अच्छे से केस लेंगे, उस पे अच्छे से वर्कआउट करेंगे और फिर जो रेमेडी ऊपर आती है वो उसमें एडमिनिस्टर करने के बाद एक कोर्स ऑफ ट्रीटमेंट में उसे अच्छी राहत गिरती है और जिस तकलीफ में वो पहले आया था वो तकलीफ उतनी उसे नहीं रहती है. एखादा क्रोनिक पॅन्क्रियाटायटिसचा पेशंट आला, त्याची चांगल्याने केस घेतली, त्या केसवर चांगल्याने वर्कआउट केलं, त्यानंतर जे औषध वर निघून येतं ते त्याला दिलं आणि त्याला चांगल्याने लागलं तर एका कोर्स ऑफ ट्रीटमेंट नंतर त्याला तितका प्रमाणात त्रास राहत नाही ज्या प्रमाणात तो आधी आला होता. As we says, we treat the man in disease and not the only disease in man. So, if you like this video, subscribe to my channel. Thank you.